There we go. And I'm going to record this so we can send it links. So we've got Dariette from the UK. Hello. So good to have you with us. Today we are going to be starting in just a moment. We're going to be talking about fiber structure. Specifically, we'll talk about transversals. So if you're new to iridology, this might be brand new for you. And if you've been around iridology for a while, this might be a refresher for you. And depending on if you've got a background in iridology, that will determine what angle you take on transversals. I am, of course, giving you the constitutional approach to transversals. I know I'm going to lose my camera. This camera doesn't like it when I move it, but I need to move it here because, oh my goodness, it didn't turn itself off. That's a first. Hello. Oh my goodness, that's just okay. Brilliant, fabulous, love it. Okay. Wow. Okay, when tech is actually working the way it's supposed to, we go woohoo, right? We celebrate. Okay, and so we are going to get rocking and rolling. We've got a couple of people with us on Facebook. I would love it if you're on Facebook with me, if you'd say hello. We've got Shannon who's joined us on the webinar. Welcome, Shannon. I'd love to know where you're from. We've got another joiner, 6886 on Instagram. Thank you for being there. Again, wherever you are, say hello. Let me know where you're from. It is just so good to get to know you. And we've got Dawn Cunningham. Hello, Dawn. I think you're from Alberta, aren't you? I recognize your name. And so this is great. Alrighty, so here we go. A short introduction of myself, just so that you know who I am and why I am teaching this information here. My name is Judith Cobb. I am a master herbalist, natural nutrition clinical practitioner, and certified iridology instructor, as well as a certified iridologist with IPA. I have been in the holistic health business for over 4 decades now. This is what I did instead of finishing university to be a school teacher, much to my father's dismay. But I am so glad I made that switch. I realized just before I was set to graduate, I had like 1 more semester left, that teaching other people's children was, as much as I had thought it was going to be the love of my life, I realized it was not. It was not resonating with me as I did my student teaching. It did not feel good. And that was when I jumped ship. I actually dropped out to get married. We started our family, but this whole holistic health thing presented itself to me. It had been setting itself up since I was a teenager, and I just didn't know it. But I was open to what was coming down the pipes at me, and that was a good thing, a very, very good thing. We are going to talk a little bit about specific iridology principles today. I'm going to also take a few minutes to give you just a 2-minute commercial, an introduction to a course that we have starting in September, so that you can be thinking about whether this is what you want to do, whether it's the right time for you, whether you're the right student for the course, all that kind of good stuff, right? Again, those of you who are joining me on Facebook, please say hello. I love to know who you are. I got into holistic health because I had some health problems. And hello, Dew and Angeline and Viveka, and oh, we've got so many joining us on Instagram. Thank you for being there. I had health problems as a young adult, and I was home from university for the summer. The doctors were not coming up with any answers, and I got really fed up. Got fed up with all of the testing and no answers. They were not saying, well, we've ruled this out. We've narrowed it down to this list of things. I was just getting fed up with this. And that's not to say that the medical world is bad. 2 years ago, I broke my arm very badly. It needed surgery. I was grateful to have them for that. But for general health things, I was not impressed, even as a 20-year-old. And so that summer is actually when I met the man I married. And he was into natural things. He was into nutrition. He was into herbs. And I loved what he was saying. And I glommed onto it and I ran with it. And now we laugh because He was so far ahead of me back then, and now because this is my career, I'm so far ahead of him, and it's wonderful. It was the way my life was supposed to play out. Over all of these years in the industry, I've written several books, written self-published, self-distributed several books: Pregnancy Naturally, The Herbal Birth Kit Handbook, Healthy Kids Naturally, The Essential Guide to Nature's Sunshine Products, Biokinesiology and Color Therapy Level 1 and 2. And my most recent book is called The Confident Nutritionist Dynamic Iridology Textbook. It is a digital textbook. It is the one that my students use in the course we teach, and it has been approved by IPA as being an approved textbook, but it is only available to my students. Over all of these years, I've also taught and created a lot of courses in holistic health. My very first one was to, hello, Be Well and Casaluna. I hope I said that right. It's good to see you. Over all these years, the first course that I started teaching some 35 years ago was a herbal course for home use. It was to teach people how to use commercially prepared herbs in their families and with their families, because back then the internet didn't exist. There were very few herbal books and people were hungry for this information. I used to teach that as a live class here in Calgary. We always had a wait list. The class maxed out at 20 students and there was always a wait list, and sometimes my coordinator would say, can we run a second section? And I'd say, yes, I've got time, or no, I don't. So we worked with that, and the graduates of that course wanted more. And so we created a 16-hour advanced herbal course for home use. Again, and this was all using commercially prepared herbs. I was not teaching them how to wildcraft. I wasn't teaching them how to dry things or make tinctures or salves. We were buying things commercially and learning how to use them. And my students loved that. Some of them actually used that as the foundation to go on and start consulting and coaching people for their health, which was brilliant. I also designed and taught biokinesiology and color therapy level 1 and 2. For a few years, I was a certified prenatal educator with the ICEA. So I designed and taught prenatal classes. I've always had a love and an interest in things about fertility and pregnancy and labor and delivery, which is probably why we ended up with 7 children. And I loved teaching prenatal classes. Then I created the Dynamic Iridology Assessment System, which is a course that is approved by IPA. It includes the level 1 and level 2 curriculum. It is specifically designed for holistic health practitioners because I insist that my students have a background in anatomy and physiology, that they have completed at least one college level course in anatomy and physiology, because I don't take time to explain the functions of the organs and how they interrelate. I assume you know that, and it allows us to dive deeper. And I'm really sticky on that point because I found that in the past, when I used to have students come into the class that didn't have the A and P, they would drop out partway through because it was over their heads. And I didn't have time to go back and cover anatomy with them. So now I'm a stickler. You've got to have a background, at least in A and P, if not in holistic health, like in herbs or nutrition or something like that. Stay with me till the end of today. I'm going to spend just a few minutes talking a little bit more about the course as it's coming up. I am an IPA certified iridologist. I've been an IPA certified iridologist since longer than 2022, but they issue the badges every 2 years. And so the old ones are defunct and the new ones come out. I'm also a certified iridology instructor. Again, they issue these badges for 2 years. And so the previous one is erased and the current one is what we go with. All righty, so good to have you with me. Are you ready to learn a little bit about transversals? If you are ready, give me a big fat yes in the comments box. I was going to say, drop the word transversals in the comments box. And then I thought, I don't know if everyone knows how to spell that. So if you are ready to learn, and Dawn, are you ready? Are you ready? April says she's ready. Yes, April, welcome. And Ray says yes with an exclamation mark as well. Fabulous. Excellent. Let's take a look. In order to know transversals, we have to look at the structure of the iris of the eye. This is super, super important. You know, it's funny, I'd seen this diagram for about 3 decades. And when I finally put my iridology textbook together, I began to understand what this diagram was. I don't know, the dawn arrives a little later at my house, I guess. And so just in case you've seen a diagram like this and you're going, oh, what? Let's go over what it's like. And Tara, good to see you. Thank you. I'm glad you're ready. And Peggy's ready as well. And so is Dawn. Excellent. They're with us in Facebook. Okay, so when we are looking at this, this is one side of the iris. So I want you to imagine that we've got an iris. It's shaped like a donut. We've laid it down on the table and we've cut it in half. So now we're looking at the ends, the cut ends of the donut. Is that making sense so far? And so this is one side of the donut. Then we would have the pupil sitting right here. On the other side of the donut would be off the screen to the right-hand side. So we're looking at one end of that cut donut. So this is an end-on cross section of the iris itself, just the iris. Did that make sense? If that made sense, put makes sense, give me a makes sense in the comments box so I know that we're on the same page. Did that make sense what we're looking at here? We're looking at an end-on cross section of the iris. Make sense? Yeah. Okay, Ray, thank you. So it's at least making sense for Ray. That's what we need to know. All right, so when we look at this, this is the top layer of the iris. This is the front-facing layer of the iris. This is the part that we look at. It's called the anterior border layer. This is where pigment resides. So when we have a dark brown eye, this is where that brown pigment is sitting. This is the back side of the iris. This is actually pointing in towards the hollow of the eyeball, or of the anterior chamber. And so this is the posterior epithelium. We don't see this because it's pointing inwards, right? This whole section here is called the stroma. Collectively, it's called the stroma. And the stroma is made up of muscles that are located in various directions. It's made up of blood vessels and nerves, and it is made up of what we call trabeculae. Now, trabeculae are the individual fibers that we are looking at. So let's pop a look here. When we look at a blue eye, for instance, or a lymphatic eye, and I'm just going to move my camera closer for our Instagram viewers, each of these individual threads is called a trabecula. And when we are looking at a trabecula, what we are actually looking at is a capillary that has a collagen sheath. Capillaries would be pink. The collagen on it makes it white. So each of these is all about blood flow in the iris. Normally, they start at the limbus, come towards the collarette, make a hairpin turn, and return to the collarette. So we have an arterial flow and a venous flow. Is this working for you? If this is making sense to you, give me a 1 in the comments. We've got lots of people joining us on Instagram. It's good to see you. Thank you for being there. If that is making sense so far, give me a 1. And Ray, this is fitting for her. That's great. Everybody else okay too? Are we good? Martha says 1 and Dawn says 1. Fabulous. Excellent. And good to see you with us, Dawn. Thanks for being there. Dawn is one of my recent graduates of the course. And we've got lots of people on Instagram giving us 1s and on Facebook. Fabulous. So we've got a Dawn on the webinar and a different Dawn on Facebook. So I apologize if that's confusing my Dawns. All right. What we see though is when we look at someone who has dark brown eyes, we have loads of pigment in that eye. And remember, the pigment is sitting on top of or in front of the stroma. And the pigment will, if it's dense enough, like it is in most brown eyes, will almost always completely veil the stroma. It will hide the fiber structure. All right. So it's like we've got a thick layer of paint that is hiding everything beneath it. Occasionally, you will see that in some brown eyes, we will see fiber structure, not so much as stroma, but we will see fiber structure as lacunae. It's not overly common to see this, but when we see it, it does teach us a little bit about how this person is put together. And Ray says, I'm a nurse, so I get A and P. Excellent. I'm so glad you do that. It just makes it so much easier. All right. So here we are looking at the eye of a 4-year-old girl. In constitutional iridology, what we know is that the fiber structure is what you are born with. So the way this little girl's fibers are sitting in her eyes are exactly the way she was created genetically. There is nothing we are going to be able to do, diet, cleansing, I don't know what else you could do, that is going to actually move fibers in her eye. So as we talk about transversals particularly, we're looking right here and we see we've got these little fibers that are not doing what we thought they were supposed to do. Remember, we said at the outset that the trabeculae start at the limbus, come towards the collarette, do a hairpin turn and come back out to the limbus. Now, it's not usually a tight hairpin turn. Usually it's coming in and going out somewhere a little ways away. But in this case, for some reason, this little girl has trabeculae that are going off in a different direction. So as we're looking at trabeculae, we've even got another little one skittering right across here. Okay, so when we're looking at trabeculae and we're looking at some of them that are not doing what we expect them to do, we find some areas where there are more trabeculae, so things are more densely packed, and compare that to areas where there's fewer trabeculae, so things are less densely packed. This gives us information. Areas where we have less trabeculae generally correspond to areas of the body where there is less genetic resilience. Okay. And where we have fibers that are skittering off across other fibers, this again correlates to an organ or a few organs, and it tells us there may be some challenges with those organs. This person may be a little bit more prone to inflammation or creating scar tissue or adhesions in these organs. And so our first thing when we look at an eye like this is to understand that it's a lymphatic eye and to understand what the underlying predispositions of the lymphatic constitution are, right? And then we look to see what else do we have happening color-wise. And in this case, we've got a lot of white. We've got some specific clouding at the edges. How does that add to the story of what this little girl's health potential is? Not what her health is right now, but what her health potential is. And then we look at, find these fibers that are doing their own thing. And we correlate that to an iridology map. And we are able to see which organs may be more likely to run into trouble. So we take all of this information and we correlate it. And then we, of course, we've asked our client already, what would you like my help with? And we evaluate the information we've gathered, including that constitutional type, the general disposition and dispersion, if you will, of the fibers and any unique fibers. And we do that analysis of how does this information help me understand why my client is having the symptoms she's having. Now, fortunately, this little girl had no symptoms when she came to me. Her mom is, she is a third generation client. Her mom was a client of mine, and so was her grandma. And so this little girl, the mom was just coming in proactively saying, I just need to understand more about my daughter so that I can make sure that I'm nourishing her well. I love that kind of client where they want to be proactive. And we were able to, based on what we see in this eye, suggest that the diet was already extremely good, but there were a few little things like a little less dairy. There wasn't much dairy, but we wanted that to come down, maybe a little more digestive support. And particularly with this little girl, what she really needed was time to decompress. So at the end of the day, it's important for her to just have some one-on-one time with mom or with dad to talk about her day and how it went. Even at the age of 4, important for her to learn those life skills of how to release the stress from the day. Here's another example of a 12-year-old boy. Now, as we look at this, he's got excellent fiber structure overall, a few areas that are a little bit looser, but not really horribly bad at all. He's got a little bit of transversal activity over here. And so we want to look at this in light, again, of family history. Now, again, I know 3 generations of this family as well. We know this is the left eye. And knowing this is the left eye helps us to see that this is sitting in the heart-lung area. And this is coming into the base of the lung and into maybe even the top of the spleen down here. Now, this little boy's, I shouldn't call him a little boy. Like I said, I know this family well. He's now 16, a tall, good-looking young man, and smart as a whip and talented in so many ways. Okay, he's my grandson. And so, but really, that's all true. I'm not making it up. And as we look at this and we know the family history, on my side of the family and on my husband's side of the family, we've got a truckload of heart disease and some lung issues. So he's inherited that, and we can see that possibility. He hasn't inherited the disease processes. He's inherited the possibility to have problems. All right. And so when we see this and we know he's so young, we know that there are some things that he needs to be aware of. Now, his mom is brilliant in every way possible. She feeds this family so well, so nutritiously. Do they get treats and a bit of junk food? Yes, they do. But the meals are so amazing, and lots of vegetables, good proteins, whole grains. There's no white flour, no white sugar, no junk food, right? This young man is very physically active, so he's doing that to protect his heart. They live in a fairly rural community, which means it can be pretty dusty there with all the farms and the feedlots that are around them. But again, at least he's not in smog, right? He has no allergies, so this is good. So as we look at how his fibers are laying in his eye, we know where the challenges could be. And as we know where his challenges could be, we can then modify his diet. We can teach him lifestyle skills. We can teach him about supplements that he can use if he's running into any trouble, right? Now, he's extremely athletic. He's a very high functioning soccer player, plays soccer year round and does every team and individual sport that he can at school, which is every one of them actually. And so he's extremely physically active, and that is also serving him very well. Here we have another example of a beautiful blue eye. Now I want you to look at this eye very carefully. And compare it to this one. Do you notice here how straight the fibers are? Now, a part of that is due to the fact that the pupil is small because the light was bright and it pulled the pupil size down. Okay. Here, the pupil is slightly larger. Do you see how wavy and wobbly the fibers are? Can you see that they're not as straight? This is in part due to the fact that the pupil is slightly larger. This is a really important point. These trabeculae are long enough to go from the limbus to the collarette and back when the pupil is very constricted. I want you to think of this like an accordion. So when the accordion is compressed, when it's squeezed together, that's like the pupil getting big and we're squeezing this. This is our accordion. We're squeezing this together. That's going to make these fibers more zigzaggy, more wavy. When the accordion is stretched out, which would happen when the pupil gets smaller, these fibers are stretched out and they're going to go straighter. Okay, so the fact that these are wavy is not a problem. What we are looking for is, do we have any trabeculae that are skittering off across other trabeculae? Again, we are never going to move these. This is a genetic predisposition. This is a right iris. This is coming down through the ovary testy area. I don't remember if this is a boy or a girl. I should know that, a male or a female. And it's coming down into the base of the kidney, which has a little bit of shading and rarefaction in here. So we're really going to be watching the ovary testy with this person. We are going to be asking those questions if they're appropriate. So if this client came in with questions about their reproductive system, we would definitely pay attention to this in the first appointment. If this client came in with concerns about the digestive tract, this would be put on the back burner because it's not important to what the client is asking for right now. Dawn is asking, let's just pop back one, would I consider this to be a biliary or a lymphatic eye? I consider this to be a lymphatic eye because it has a lot of blue in it, right? Biliary eyes do not have any visible blue. All right, so you got some iridology behind you, I can tell it. That's great. So back here again, if this person came in with concerns about their reproductive system, a female with menstrual issues or hormonal issues, then we would pay attention to this and we would want to find out if there'd been any medical testing done, had there been any ultrasound done, was there anything unusual that showed on the ovaries? If it was a male, we'd ask the same questions. Has there been an ultrasound done? Is there anything unusual with the testicles? And then from there, we would be able to dig deeper with our questioning to get better and better answers. So this again suggests an increased risk of scar tissue, of adhesions, of inflammation in that organ or organ area. Here we have a beautiful set of lymphatic irides again. Now, once again, we look at this and we go, well, the pupils are fairly small. Even with the fairly small pupils, the fibers are not really totally straight. And because they are not totally straight, we're going to wonder about how well this person repairs their connective tissue. It's going to be one thing that we're going to want to ask. And we are going to look also for those bizarre little fibers that run off across other fibers, like we've got one down here. And I'm sure there's more in that right eye. In this left eye, we've got quite a little pocket of them here. So we are between roughly 7 o'clock and almost 8 o'clock, or 6:45 and 7:45. We've got a lot down there. So this again is hitting the uterus, the vagina, the bladder. So if this client came in with bladder concerns, we would see that, yes, we've got a risk of something there, and we could dig deeper. If this client came in with reproductive concerns or menstrual concerns, we could come in with questions that were about that. If this client came in with lung concerns, I'm not going to pay attention to these fibers just yet. I'm going to address my client's concerns first, get us getting some good results there. And once we've got the lung concerns dealt with, then we are going to see that that she's more aware of other concerns. What I find happens is we have layers. Clients come in, and the most pressing, the most life-changing symptom is what they want help with first. And we know the symptom is not the problem. The symptom gives us information to help us find out where the problem really is. And as we deal with that and that symptom goes away, becomes less significant, then the next symptom rises to the top and we can deal with it. So we deal with things in a very sequential, very logical way so as not to overwhelm the client. Here we go. Here we have another client, and I'm using a lot of blue eyes because it's so much easier to see the fiber structure in a blue iris, correct? Harder to see in the brown iris, as we noted earlier. And so as we look at these blue eyes, what do we see for fiber structure? She came in with some breathing issues. She's in her 60s. And what we see is when we look at the lung area, we've got some interesting bits of fiber and accumulation. Pigment, including white, accumulates with time. When we look at at her right eye, we see the same kind of accumulation, but we also see this really big fiber coming down here. And so we know that inherently she is predisposed to something with her lungs. She's not a smoker, so that's a good thing, but she's also not physically active. And her diet is okay, but it's not great. So we want to start working with the diet. We want to potentially suggest supplements, and we want to then build from there. Here we have a 3-generation study. Now this is interesting because, oh, I need to leave that there. We'll move that there. This is the grandma. This is her son. This is his daughter. Okay, so let's look at these. In this image, and we're looking at fiber structure only, we see fairly straight fibers overall, except for a few of these trabeculae that are really doing their own thing, kind of going all over the map, right? So we know that the grandma is prone to some inflammation, prone to possibly some adhesions, prone to some scarring. We look at the father. And the father is now mid-30s, early 30s, 32-ish. We see he also has a lot of potential for scarring or adhesions. And notice where this is. So grandma, we've got all right eyes here, makes it easier to compare. Grandma has something in her lungs, or this marking that says a potential issue with the lungs. Grandma is extremely physically active. She's in her 60s. She does everything she can to stay active and watch her diet and take supplements. We have this large transversal that spans the liver. There is a history of some pretty intense liver stuff. And the family never drank alcohol, so there's nothing related to alcohol. Coming down through, reaching down almost into the ovary area, not quite, well, maybe the tip of. There was a little bit of, grandma was a little bit PCOS as a late teenager till she figured out her nutrition and got on track. Then son has this sitting in the lung area, heart-lung area. And so we're watching that for him, and he doesn't smoke, and he's physically active, and he's very diet conscious. So those are all good things. We need to watch emotionally as well, because lungs are all about grief, right? And we need to make sure that he processes his grief well. And then when we look at his daughter, she didn't get, well, she got a little teeny bit right here. So we're watching her lungs a little bit as well. Right? So we see how that lung transversal, not exactly the same marking, but it has passed down through the generations. It's an inherent marking. Is that all making sense? I love doing generational studies to see how things get passed down. It's so fascinating. It really is. All righty. So any questions on any of that? Did it make sense? Martha says fascinating. If this made sense, just give me maybe a 2. Give me a number 2 in the comments box so that I know that it was good for you. Just take, and Ray is saying too, yes, Ray, good job. Good job. So just to introduce you to the upcoming course, Dynamic Iridology, Assessment System for Holistic Practitioners. This is the only online fully mentored course for nutritionists, herbalists, and naturopaths who want to streamline their clinical work without sacrificing client care. This is so important because so many holistic practitioners, especially herbalists, nutritionists, and naturopaths, meet with a client, they gather information, then the practitioner goes and spends 2 or 3 or 4 hours of their own time. Thanks for weighing in on that, Instagram people. Good to have you with us. And they spend 2 or 3 or 4 hours of their own time creating a protocol that they then go back to the client with in a future appointment. Problem is, they're not actually charging enough to cover those hours of program creation time. When we do iridology, constitutional iridology properly, and you've heard me allude to this many times in this little workshop, we actually create the program right in the client session. We focus on what the client's needs are, use the eyes to help add information, use the eyes to guide the questions we want to ask, and we construct their next steps program right in the paid client session. So whether your reason for popping in on this webinar today was to learn a bit of iridology, or whether it was because you're spending way too much time creating client programs and it's killing you, it's killing your income, it's draining you and depleting you, I'm glad you were here. And I hope that what you've learned today is going to be a bit helpful. Now, I have made one little mistake and I don't think I can correct it right this instant. But here's what I'm going to do is at 12 o'clock, so in 20 minutes, I'm doing an introductory webinar for the course that is starting on September 9th. In this webinar that's starting in just 20 minutes, I know that's short notice. Some of you are already signed up for that. Some of you are going, oh my goodness, have I got 2 hours free? It's going to be about 1 hour and 3/4 that we'll be together. We're going to go over who the course is designed for, what problems they might be having in their clinical practice right now that iridology can help them with. We're going to talk about how the course is delivered. We'll talk about tuition and payment options. We'll talk about everything that you get. And so we'll give you lots of details. Now, if you are interested in this, shoot me a PM, send me a note in the text box. Dawn Cowley says, fabulous course, highly recommended. Judith is a great teacher. Dawn, thank you so much. That means a lot to me, because Dawn is actually a professional teacher. So thank you, Dawn. I hope that's okay that I mentioned that. That means a lot to me. Thank you so much. I would, if you are interested, shoot me a private message because I will grab your email off the registrants list and I will send you the link for the webinar that happens in 20 minutes. With an increase of eye surgeries, especially cataract surgeries, lens replacement, does that affect an assessment? It depends on how the surgery was done. Let's just pop back for just a moment to a single eye photo. I've seen eye surgeries where they went in through the top edge of the iris and we have two black scars there. So obviously, when we see a black patch in the eye, we want to ask questions. And my question was, because it was matching black spots on both eyes, have you ever had eye surgery? And the answer was yes. It was a thank goodness, because that's just scar tissue. It depends on where the surgery is. I've had people that have had different surgeries where they've gone in through the edge of the iris, and it does mess up your analysis significantly. If there's been a significant injury, for example, my mom literally as a little child fell and a sharp stick in her eye, poking the eye with a sharp stick, that was my mom. And that eye is blind, it's damaged, you can't read anything, but her good eye, you can read. The modern way of doing cataract surgery and lens replacement is they super dilate the pupil, and then they go in through the edge of the lens, and they're able to extract the cataract, put in the new lens, and stitch it shut, so that when the pupil comes down to even a normally large size, not a super dilated size, there's no indication of the surgery. So they haven't interrupted the iris at all. So not at all, not a problem for most surgeries now. Can students of naturopathic medicine during the course? Absolutely do. The iridology program that I teach is designed especially for herbalists, nutritionists, and naturopaths, because I'm looking for students who have a good understanding of anatomy and physiology so that we can dive deeper. Peggy Cockrell is with us on Facebook. She is also a graduate of the course, and she says she agrees with Dawn, saying it's a fabulous course. And so thank you so much for that, Peggy. I truly appreciate it. I love my students. They are such amazing people, just in and of their own right. But I feel like I attract people who are amazing. So if you're amazing, please reach out to me. You are amazing, or you wouldn't be here with me right now. And Ray says she's interested in the webinar. Excellent, Ray. I will make sure you get that link. And if anybody else is interested, just shoot me a private message of some description and I will make sure you get that link. I hope that this has been helpful for you to understand a little bit more about fiber structure. Of course, in the scope of the course, we go much, much deeper into many, many different fiber structures that we see in an iris. We spend hours doing this. Angel Lines 21, need the link, please. Fabulous. Angel Lines, would you send me a DM on Instagram, please, so that I can DM that back to you? That would be fabulous. And I will get that right too. Martha has done many of my courses. She says, I've loved all of Judith's classes. She over delivers. Thank you so much, Martha. That is my goal. Under promise, over deliver. I want all of my students to have the most amazing experience possible when they do a course with me. And so again, I'm just going to make notes so that I can find you again as we need to. So that I can make sure links go out to people if I need to dig a little quickly to find you. And she's on the webinar. Okay, fabulous. Okay, so with that, my friends, how will the course last? Fabulous question. We will cover all of that in the upcoming webinar. It is just a brief little touch on that. 20 weeks long, 2 hours of live online instruction per week, plus several opportunities over the course of the course and beyond to get extra support and extra mentoring and make sure you've got the information. So it's a 40-hour long program just for content delivery. Excellent. So with that, my friends, We need to scoot to get set up for the 12 noon webinar. Again, if you are interested in attending this course info webinar that's happening in just 15 minutes, send me a PM or a DM. Somehow let me know you're interested, and I'll make sure you get that link within the next 15 minutes. I look forward to talking to you really soon, and we will, I hope you stay safe wherever you are. I know we've got forest fires not close to me, but in our province and in neighboring states and provinces. So I hope you stay safe wherever you are, and love to see you real soon. Take good care. Bye for now.